let's get started.
Okay.
And first of all, Michelle.
Yes.
Thank you so much for being here.
Thank you
with
for
us
inviting me.
and telling your story, which I'm sure is going to be very, very impactful. So I just want to start off by asking a simple question. I know you're the caregiver of a very brave woman, your daughter Kayla.
Yeah.
Can you tell us a little bit about her?
Yeah, sure. Well, hi everyone. My name is Michelle Kim. I'm a mother of 3 children. I have 1 daughter. My only daughter, her name is Kayla. And if I had to describe Kayla in 3 words, it would be resilient, brave, and funny. She is the most special person I have ever met. And unfortunately, she has multiple life-limiting rare diseases. And she has spent her life in and out of the hospital. But last year, 2022, we spent almost 6 months in the hospital at UCLA. She picked up one infection after another, and as a result of all of those, she suffered kidney failure, and now she's on dialysis. There was one point in the ICU, she had been in a coma for 3 weeks, and when she came out, she was still very, very, very sick, multiple organs affected, and the ICU doctor asked me, "Do you want to take her home on hospice?" I'm not sure if you know what hospice is. Okay. So I said, you know, that's not really my decision. I had to have that difficult discussion with my daughter and ask her, do you want to go home do you want to go home and be with Jesus? Or do you want to keep fighting? And she kind of looked at me funny, and she kind of laughed, and she's like, of course I want to keep fighting, Mom. And I said, okay, I'm getting weepy already. I said I wasn't going to cry today. I said, if you're going to fight, I'm going to fight with you every step of the way. And so since we got home August 27, 2022, we have been fighting together every single day.
Now, you were saying your daughter had lots of challenges.
Yeah.
And one of the challenges has been with so-called PICC line
Yes.
dressing
Yes.
changes, right?
Yes.
And so can you talk a little bit about that challenge and probably also explain
Yeah.
what a PICC line dressing change is?
So since we're kind of a small group here, how many people here know what a PICC line is? Do most people know? So maybe like half? Okay. So basically, you have an IV. That's a way to get medication, IV medication into your body, maybe get blood, maybe get some blood draws. So a PICC line is kind of a long-term IV. So they insert it into your arm, and then it goes to the large veins into your heart. And there, it's really great to have a PICC line because you can draw blood, you don't have to get stuck all the time. My daughter got multiple blood transfusions, tons and tons of IV antibiotics. She even got food through this IV line when she couldn't eat anymore. So it's a fantastic device. The problem with the PICC line is the infection. You have to be really, really careful about infection. And in fact, while she was admitted, she got a PICC line infection. And she got a fungal infection, and that is I saw someone grimacing. Somebody knows what a fungal infection is. Has a very high mortality rate, and she almost died. She spent 3 weeks in the coma due to the PICC line infection. And so one of the things that was really, really challenging for her when she was in the hospital, I mean, this girl has gotten so many horrific things. I'll just describe like 2. She got the fungal infection and went to her eyes. They had to inject antifungal medication into her eyeballs. I had to leave the room for that one, yes, because I know I'm a bad mom. I couldn't watch it. She had a big wound on her sacrum from being in bed so long, and the blood vessel burst open. They had to call emergency surgery, and while she was awake, they stitched up the blood vessel in her wound on her butt. So things like that were happening to her, and she weathered all of those like a trooper. Man, if it had been me, forget it. But the thing that she hated the most in those almost 6 months of staying at the hospital was this PICC line dressing change. And so with the PICC line, you have to keep it, the PICC line is the one on her arm. The other one is her dialysis line. So the one in her arm to the very of my far right, you have to change that dressing every week because you want to make sure that it's not seeding bacteria or any kind of infectious material. You have to change the dressing, and this would be a Sunday night affair. And let me tell you, for her, she cried. It was so painful, and it was unbearable to watch. I mean, how many people here are parents? Any parents? Okay, what is like the worst thing as a parent? Is to watch your child in physical pain. It could even be like the flu shot, but to see them crying in pain, you might as well rip your heart out. And it was like that for me for this PICC line dressing. And so some of the things that happened, the PICC line has to be held in place with a securement device because the PICC line can easily be you could just grab it and pull it out yourself. And then you would lose your lifeline to medication. So you need a securement device on the PICC line to just hold it in place. The securement device has to be changed every week. And so when they removed it, it would actually rip her skin off. And not only would it rip the skin off, the torture continues. They have to clean it with chlorhexidine. So that's kind of like an alcohol disinfectant. So that would burn. And you don't just like put a Band-Aid on it and let it heal. You have to put the catheter, the securement device back on because you need to hold the PICC line in place. So that happened to her. And the other challenging thing was with this securement device has two little prongs that fit into two little holes in the PICC line. And you have to press down really hard onto the bone in your arm to get this device to click into place. And she would actually come out with bruises from having the securement device in place. And then the last thing that completely flipped me out is because it was so hard to get these little prongs in the holes, the line would move in and out of the hole in your skin. And this is a huge infectious risk. And after her line got infected with a fungal infection, I was a complete freak. Every time the nurses came and changed the dressing, I see there's someone who knows exactly what I'm talking about. I'd be like, the line moved, the line moved. And now this was such a difficult and challenging thing, which really should be quite simple. UCLA requires 2 nurses to come and do the PICC line dressing change. And you can imagine, if you've stayed in the hospital in the past year or 2, there's no medical staff. And so to have 2 nurses spend their time doing this dressing change was just crazy. So they would come in, my daughter would cry and beg them, please no dressing change, please no dressing change. I felt terrible for her, and I was so stressed about her getting another line infection.
So, Michelle, how did you find out then about ClickFix?
Yeah, so after we got home from the hospital, I was sleeping like 3-4 hours a night. My daughter had kidney failure, so we were driving 4 days a week to UCLA for dialysis, getting blood transfusions, all these things at home. She couldn't walk anymore, so we had to carry her. It was really, really hard. She's also on a product called IVIG, which is immunoglobulin treatment, and that the nurse has to come to our house and administer through her wonderful PICC line. And she's like, Michelle, I went to this trade show, a nursing convention in Florida, and I found this device, maybe you want to try it. And I was like, Angela, I have so much going on right now. Please don't talk to me. She's like, okay, no problem. She comes every week. She's like, you might just want to check this thing out. And then finally I was like, after the last dressing change where Kayla's like screaming, I said, all right, let me see it. And I was shocked. Am I supposed to talk about the... I was shocked. I was shocked because this thing was so easy. So easy. So the other device has this plastic thing with 2 holes. You have to press down on the bone, causing bruising. This ClickFix device is like 2 little arms, 2 little fuzzy arms that cross over, holding the line in place. like a little hug. And it was so easy to use. You didn't have to have it in service. You didn't have to watch it. Like, your child could use, a 5-year-old could use it. It was so simple. I was so shocked when I saw this device. My daughter was so happy. Taking the Click Fix device off, it comes off like smooth like butter. I know you all here for all these fancy, innovative, things out there at the booths. I don't even understand what they are. But this simple Click Fix securement device was life-saving for my child.
So this is really about patient experience.
Yeah, yeah.
And, can you just talk a little bit more about?
Yeah. The thing that I really want to share, Jean-Claude, is this other picture. So anyone in the medical field? Okay. So the picture on the far right is the PICC line that I keep talking about, how to deliver long-term IV therapy. It's this picture in the middle. I know it's a little graphic. Thank you for looking at it. It's the dialysis catheter. And what that is it basically, this is what I do at home. I take all the blood out of my daughter's body, I throw it through a filter, and I put it back into her body through this line, her HD cath. It is her lifeline. Without it, she would die. It is not easy to put in. Once you put it in, it's called a tunneled catheter. The tissue is supposed to grow around it to hold it in place, your own body tissue. That takes a long time for some people. And so this catheter, in the meantime, is held in place with stitches. So you can see some of the black stitches on the right. On the left was like a few weeks later, the stitches had come out. You can see all the bruising. But not only that, what I realized is that the catheter was sometimes dangling way down here, and sometimes it was pushed all the way up. And I was like, isn't this just a giant PICC line? And they're like, yeah, kind of. And I'm like, why is it going in and out, in and out? It's huge infectious risk. This thing cannot get affected. I cannot have her lose her lifeline, her kidney. This is her kidney. You cannot live without your kidney. And so I brought her back to the interventional radiologist, and I said, we have a problem here. This line is moving in and out, and I'm afraid it's going to fall out. And I'm in a support group, and let me tell you, this happens to a lot of people, where this catheter just falls out. And she pulls out, she's like, no problem, Michelle, I got you. And she pulls out this suture kit. And my daughter's sitting right there, and I'm like, hello, what's happening right now? She goes, oh, I'm going to stitch it back in place. And I'm like, I don't think so. What are you talking about? She's sitting right here. So I had this Click Fix in my hand, for the PICC line. And I was like, do you think that this could be helpful to you? This interventional radiologist, let me tell you the relief on her face, because this woman was stressed out, I could tell, having to suture my daughter's HD cath back in place. She was so happy to get this Click Fix, and she used it on a dialysis catheter, which is one amazing thing about this. The other devices, I'm not an expert, so okay, please don't sue me, but have to be specific to the catheter size, whereas this Click Fix, it can be any size because you got these two little arms. You have any samples? You should show them. Two little hugging arms to a line of any size. It's really an unbelievable thing. I don't think anybody really uses it for dialysis yet. But let me tell you those, 1 minute. Oh my gosh. This is going to be a game changer for people with hemodialysis.
Now you were saying, you're talking about innovation, and we always talk about the next chip and the next very sophisticated device. And this is an example where innovation is absolutely critical and life-changing in basic care, right?
Yeah.
So I know we don't have much more time, but any more thoughts about innovation?
Yeah, it wasn't easy for me to come here today, okay? You know, it's not easy for me to leave my child, but I came for 3 reasons. One, if any of you out there have a need for any kind of securement device, I want you to look at this. Or if you're a patient, caregiver, this is a game changer. I want people to know about it because I don't want them to go through what I went through. The second thing I want to say is I'm looking at all these booths. You are all people who are highly impactful, innovators, game changers. I see what you're doing. Please don't forget about the small things. Those also are life-changing and life-saving. Believe me, I love all this stuff that's coming out. Gene editing, xenogenic transplant, you know, all of these devices, they're amazing. But the small things also can be life-changing and critical. The final thing is just amazing job, Jean-Claude. I'm so thankful that you have taken under your wing to distribute and to push out this product. I know a lot of my friends who are patients will be very happy. A lot of nurses will love doing the dressing change. And my daughter wanted to just say one thing. I was telling her I was coming today to share her story. She goes, tell them that the dressing change is easy now. I said, okay, I will do that. I will do that. So
then,
thank you.
Just very last question, Kayla.
Yeah.
How is she doing at the moment?
Yeah, I mean, she's you know, hanging in there. Unfortunately, she was turned down for her liver and kidney transplant, which would have been life-saving for her. And, you know, we never know what tomorrow will bring. I just, you know, I want every day, I want her to be happy. I want to appreciate my time with her, appreciate the present moment, you know, and not have to worry about, like, small things like a dressing change. So, yeah. Thank you.
Well, Michelle, thank
you
you
for your
so
time.
much. Very inspiring.